Here is a number that stopped me in my tracks when I first read it. Up to 80% of pregnant people receive advice during their pregnancy that directly contradicts current medical advice. 80%. So that means the vast majority of people that are growing a human are also navigating a flood of well-intentioned, but often inaccurate guidance from family, from friends, from the internet, or even from strangers and farm boy who feel compelled to comment on their belly. Now, here's what makes it a little bit more complicated. A lot of this advice actually sounds reasonable. So it gets passed down through generations and it's repeated so often that it kind of becomes a fact. But when you actually look at the research and when you dig down into what pregnancy physiology and fetal development is, so much of it falls apart.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Before we dive into today's episode, I wanted to let you know about some exciting things we have been working on at Advanced Women's Health. So we don't aim to just be excellent at appointments and excellent with the care we give to patients in terms of the protocol, but our goal is cross-clinic excellence. We want to ensure that you are getting the most wonderful onboarding experience, that you feel supported, and that fundamentally you actually are going to implement your plan. We talk about health being a lifestyle, and it is, right? It is something that needs to be modified or shifted. We need to think about things differently. We need to understand our bodies differently. We need to have those education-based aha moments or those community-based aha moments to be able to action what we know to be true and what we know we need to do. And so over the last few years, we have been consistently evolving and trying to give you the best patient care experience possible. And that has resulted in us having our new patient onboarding system. All new patients at Advanced Women's Health now get access to a plethora of resources. We go through educational pipelines and daily tips and tricks that will help you to implement your plan. We have mindset support. We have onboarding coordinators that are there to create community and hold your hand in live QA calls. We offer meal templates and meal plan structures, exercise videos and programs, community challenges, and so much more. And again, this is just included as being part of a patient of Advanced Women's Health. So if you have been on the fence, if you have been hesitating, book with one of our patient onboarding coordinators. We are here to help you pick which practitioner is the best fit for you. And then you can learn more about our onboarding systems and everything else we offer at Advanced Women's Health. So now to the episode.
Today, we are tackling that head on. Welcome back to the Advanced Women's Health Podcast. I'm Dr. Sasha Monteiro, naturopathic doctor and doula. A couple of weeks ago, we did something fun. We posted on social media and asked a simple question. What pregnancy myths have you heard from your mother-in-law, from your coworkers, from the one friend that has an opinion on everything? And you delivered. Thousands of responses came in. Some were hilarious. Some were things that were quite frustrating to read. And some were genuinely concerning myths that could lead to real harm if followed. So today I'm joined with Dr. Sasha and Amanda, and we are tackling on everything that you shared, combined with what we also constantly hear in our clinic rooms. So I will pass my mic. Dr. Sasha, why don't you introduce yourself?
Thank you, Dr. Sasha. I am also Dr. Sasha. Hello, everyone. But I am a naturopathic doctor based in Vancouver, BC, seeing patients in person in Vancouver as well as virtually all throughout BC. I focus on women's health throughout all stages of life, but a big part of my practice is helping people through preconception, fertility, pregnancy, birth, and then postpartum. So I'm really excited to be here talking about pregnancy myths because this is honestly one of the biggest times of confusion that I see in practice. Pregnancy is a really special time, but it also can be incredibly overwhelming because everywhere you look, someone has advice, there's a new rule to follow, or you've heard a myth that's been passed down. And it can be really hard to know what's actually evidence-based and what's not, especially when you're just trying to do everything that you can to have a healthy pregnancy. And it's a really important time in your life. So I'm really excited to dive into some of the common pregnancy myths today, talk about where they come from, and hopefully leave everyone feeling a little bit more informed and a lot less confused. Amanda, do you want to introduce yourself?
Yeah, so I'm so honored to be here with both of you, and I can't wait to hear both of your thoughts and share your experiences. My name's Amanda. I'm a physiotherapist. This is my 10th year practicing. I've been in health and wellness for about 17 years total. So I love physical activity. I'm a huge advocate for being active, and there's just so much uncertainty and questions around physical activity during pregnancy. So as a pelvic health physiotherapist, I love working and addressing this with my patients and working through these myths. So I'm really happy that we have this platform to talk about it today. I'm also a very proud mom of a toddler now. So she keeps me very active and busy in a different way. So I've been through pregnancy, and I'm happy to share some anecdotal experiences as well.
Amazing. So between the three of us, we've got naturopathic medicine, pelvic floor expertise, birth support, and some lived experience. So let's kind of dive into things. We've heard myths from patients. We've seen the anxiety that they create. And in some cases, we've also seen the harm that they can cause when people follow advice that isn't necessarily evidence-based. So we're going to cut through the noise. Why don't we start with a rapid fire round of the myths that you sent us? Quick responses to things that keep circulating, and then we'll slow down and really dive deeper into the big ones while also looking at the research behind it. Here's how this works. I'll read out a myth that's come directly from the DM, and one of you can take that on and we'll go deeper. So the first one I have here was, I was told absolutely no caffeine. Any amount could cause a miscarriage.
I hear this one a lot in practice, and I think it's really tough because pregnancy comes with a lot of restrictions, or so pregnant people feel. A lot of people are missing the things that help them feel like themselves, like a little sushi dinner with their partner, a glass of wine before bed, and then sometimes a morning cup of coffee is part of that routine. So I'm always really happy to be the good person to tell people the good news that they can absolutely still have their cup of coffee in the morning. The key is just moderation, which is probably going to be a big theme throughout the whole episode. Current guidelines recommend keeping caffeine intake to below about 200 milligrams per day, which what even is 200 milligrams of caffeine? That's about 1 12-ounce cup of brewed coffee or 2 shots of espresso. A matcha, for example, is about 40 to 60 milligrams of caffeine. So you could have a couple of cups of matcha, generally speaking, depending on how it's brewed in certain blends and things like that. So for most people, a morning cup of coffee can absolutely fit into a healthy pregnancy, and it can even provide some beneficial antioxidants and polyphenols that can help give you a boost throughout the day. So main takeaway is just being mindful about how much you're taking, everything in moderation, but you can still enjoy that morning cup of coffee and have a little bit of enjoyment in your life and give you a boost throughout the day, especially because pregnancy is also very tiring. So may as well give you a little bit of support there.
Yeah. I see Amanda nodding away. I know when my cousin delivered, her first request was, I don't want anything other than I want sushi ordered to the hospital room. That was the one thing that she really wanted. Okay, the next one is, my partner and I were told that we could not have sex during pregnancy, that it could hurt the baby and trigger labor.
All right. So there are some medical conditions during pregnancy that would mean sex is a no-go. Your care provider would tell you if this is the case, right? So you'll be on what's called pelvic rest. So that includes, if you come to see a pelvic floor physio or pelvic health physio, no internal exams. We're not allowed doing anything internal if you're on pelvic rest. So some of these examples would be placenta previa, visa previa, preterm premature rupture of membranes, cervical insufficiency, unexplained vaginal bleeding, any active genital herpes outbreak, certain high-risk multiple pregnancies. So if you're carrying twins or triplets or quadruplets and you're at high risk, you would have been told ahead of time that you would be on pelvic rest. There's a few other complications, but basically, if you've been told you're on pelvic rest, then sex is a no-go. Otherwise, there's no reason not to have it unless it's not important to you, or if it's making you feel uncomfortable, or if you're just anxious about the idea of it. work with your partner. There are other ways to be intimate, but there's absolutely no contraindication to sex during pregnancy. There's some nice wives' tales that it can help with your inducing labor. Maybe one of the doctors can talk a bit about that later, but absolutely there's no reason not to have sex unless you've been told you're on pelvic rest.
Yeah, I was actually going to ask you guys what your thoughts are on the wives' tale that having sex can help you induce labor and things like that. I haven't looked into the research, so I personally do not know, but I've heard of it. But I don't know if you two have any thoughts.
I have heard of it. And funny enough, I think I've heard of it from patients who are like, this is actually not what I want to do. This is the last thing on my mind. And so I've scared my partner into thinking this could trigger something on sooner rather than later. So having that conversation, especially when we're early on in the first trimester, even the second trimester.
Totally.
So if it's important to you, if that's a meaningful way for you to connect with your partner, I'm happy to talk through like positions and such that would be more comfortable during pregnancy. If it's not important to you, then don't do it. If it's just going to stress you out. But if you want to, go ahead.
Totally.
Yeah. Okay, I have a bit of a fun one. You can tell the baby sex by how you're carrying. So if you're carrying high, it's a girl, and low means it's a boy.
Yeah, I don't know. Wives' tales, like they can be freakishly true sometimes. So I'm just not going to touch that one.
Okay. And then one more for rapid fire. I thought I'd know when I was in labor because my water would break dramatically, somewhat like what I've seen in the movies. And then I spent 12 hours wondering whether I was even in labor and whether early labor was even real.
Yeah, that's a fun one. Because, yeah, contrary to popular belief, the water does not always break to start labor. Actually, it usually doesn't happen like that. In very low percentage of cases, it does. But generally speaking, not like that at all. So that's one of the biggest myths is that you'll just know the moment labor starts. But usually labor is actually pretty gradual and also can look so different from person to person. For most people, though, it just starts with mild, kind of irregular cramping that slowly builds gradually in intensity and frequency. And then eventually the water will break much later during marriage, or sometimes the medical provider in the hospital will induce that water being broken as well. So you might not even realize it's happening. So, no, it's definitely not always as obvious as the movies make it seem. Most oftentimes, it's not like that at all, just more gradual.
Okay, I think getting into even like birth expectations in a future episode would be amazing to jam in on. But rapid fire is really showing us that there is an overwhelming amount of noise out there, and sometimes myths can create that fear or even restrict behavior and lead to guilt. So let's slow down. There were a couple of good ones that came in that I really want to dig into, the ones that we think the most even real world damage. So the first one, Amanda, I think you would be really good to talk to this, is don't exercise while pregnant. Rest and take it easy. That came up both in social responses and what I hear from patients every single week in my office. Can you talk a little bit more about this one?
Yeah, it's so important to stay active while you're pregnant. I need to say that I've seen lots of patients over the years come in with like really bad diastasis recti because they didn't engage their abs at all throughout pregnancy and their belly kept expanding and the abs weren't strengthened along with it. And it makes it harder to recover. And then subsequent pregnancies, you could run into some trouble there. So stay active. There was some guideline, I think the data was like from the 80s, where pregnant people were told don't exercise to get your heart rate above 140 beats per minute. That has been removed, which is really promising. We don't have that upper limit. Some literature will tell you no more than 90% of your heart rate if you are an elite athlete training. But overall, that 140 beats per minute hard cutoff is gone, which is nice because we're all so different and we all have different exercise capacities and tolerances and preferences. The other nice thing that's come out in 2019 is the pregnancy-specific physical activity guidelines. So Canada actually put this through, so you can actually look them up. It's free access online. So we have hard guidelines for pregnancy exercise. You're meant to work up to 150 minutes per week, and you want to be working at least at a moderate intensity. So even walking is good. But if you want to exercise a little bit harder, there have been studies more recently where there's fetal heart rate monitoring happening, monitoring of the mother's health as well throughout exercise at higher intensities. That includes resistance and cardio training. and there were no adverse outcomes. We used to think that maybe as a protective mechanism during pregnancy, the blood flow would be shunted towards the muscles and away from the baby if we were to exercise. And that was a big concern. And it was a theory. So these studies that I was mentioning earlier that were actually having pregnant people in the lab being monitored, the birthing parent and the baby were being monitored throughout. It showed that shunting response didn't happen and that the blood flow to the baby was actually protected during high intensity exercise. So having said that, if it's your first time, a crazy exercise that maybe it's like HIIT, there's lots of jumping or falls risks or contact, that's definitely a no, right? We don't want anything that will lead to falls or to contact. And if it's something that is a little bit tricky for balance and you think that your balance is going to be off, maybe pregnancy is not the best time to start something new like that. But if you're inactive and you become pregnant, we used to say, don't start being active now. The data now is actually showing us it's a good time to start. It's going to protect you. It's going to protect your baby. And there are some actual beneficial health outcomes for babies that are born of active parents. And it's very beneficial for the parent to recover as well. So talk to someone if you're unsure as to how to exercise safely and how to gradually work up to it. Work with your healthcare providers to make sure that it's safe for you to start, as long as you don't have any gestational hypertension or preeclampsia. Work with your care team and make sure you find something that is enjoyable for you, because the mental health aspect of exercise is also so important. And all the support we can get during pregnancy is always welcome.
Yeah, what you really ended with is so empowering, right? A lot of people are going through pregnancy, which to them could be the first time. It's such a new experience. I think even with every pregnancy, it's so different. And for people who find movement to be enjoyable and an outlet for their mental health, it's so important to find that routine and personalize it with the changing body, right? It's a good thing that we really talked about this one. The next one I have here is about food. So a big myth that I often hear is eating for two. It sounds joyful. It also sounds self-indulgent, right? You finally get the permission to eat whatever you want as much as you want. So maybe I'll talk about this a little bit. The reality is you're not eating for two adults. You're eating for one adult and then one poppy seed, one grape, eventually one eggplant, right, as the weeks go on. And so the actual caloric need in your first trimester is close to zero extra. And then in the second trimester, that adds a little bit more, and then more in the third trimester. So when we're looking at that, I can understand why the myth exists, because it does finally allow women to stop restricting, which many women have been for so long. And so that part isn't all bad, but pregnancy shouldn't necessarily be a time for eating for two, because that swings the pendulum too far in the other direction, right? And that leads people to believe that the more volume they eat, the healthier the baby. And that's not always the case. What matters is the actual quality and your consistency. So when we look at protein, are you getting enough protein that's going to support the blood volume that's going to expand and your baby's tissue growth? And then are you getting enough iron? Because iron is really important and those needs often double in pregnancy. Are we getting enough choline, enough folate, enough omega-3s for things like neurological development, right? So those are the actual questions that I'm spending time focusing in my office, because that's what moves the needle. So not whether you've had seconds at dinner. Now, I oftentimes say to people the first trimester for some is a race to the finish line, right? We're just making sure that you're nourishing yourself. So when we reframe this, it's you may not be eating for two people, you're eating for one person who's building another person. So nutrient density becomes priority, not just the volume. And the extra snack, not skipping meals, trusting that your body is remarkably efficient at what you're doing, right? But leaving kind of the eating for two behind, because it's given more food guilt and unnecessary weight gain anxiety than it's even given any sort of nutritional guidance.
Yeah, I totally agree. You said everything perfectly there. Couldn't have said it better.
Okay, let's dive into the next one. Amanda, I'm putting you on the spot here. Just do Kegels and you'll be fine.
Okay, so this is a little bit of a misconception, but not terrible advice. So we know that connecting with the pelvic floor is so important, and it's important for being able to deliver vaginally and to help recover after C births. So this is due to the strong connection between our pelvic floor and our core. And we can talk about this on another episode because I have so much to talk about on that one. If it is safe for you to do your Kegels or your pelvic floor contractions, do so. This allows your brain to talk to your pelvic floor. And so this is really important to be able to have this mind-muscle connection to prepare for vaginal deliveries. The problem lies when there's already too much upregulation or tension in the pelvic floor. And that's when we want to find a balance. So generally, when I'm working with patients, we're looking for a balance between the strengthening and relaxation or lengthening of the pelvic floor musculature. And this is part of a holistic care plan. So Kegels, strengthening your pelvic floor, not a bad thing because our pelvic floor is working really hard to hold our pelvic organs up. And one of them is our uterus, which starts off as the size of your fist and grows to the size of a watermelon. So we do need to strengthen the pelvic floor. We do need to have that mind-muscle connection. But of course, with everything, there is a balance. And if you don't know how to find your pelvic floor, I strongly recommend working with a care provider to help you do that.
Okay, amazing. Now, potentially our last one is you should bounce back after pregnancy. We may be previewing potentially next episode here, but this myth connects so directly to everything we've been discussing that I thought, why not introduce it? The bounce back narrative, the pressure that your body must return to pre-pregnancy and life as quickly as possible. Dr. Sasha, do you want to take this on?
Sure, yeah. I definitely think this is a really big one, especially with today's day and age and social media and just seeing people and influencers bounce back. There's a lot of pressure for people to look like their pre-pregnancy self as quickly as possible. And of course, we're very supportive of having a healthy lifestyle, trying to be able to get back to your nutrients and exercise routine and things like that. It's also very important to try not to rush that process with anything extreme or anything restrictive that could do more harm than good, because you're still healing after going through a birth, whether it's vaginal or C-section. Your body's still returning all that nutrients to itself. And even if you're breastfeeding, say you're delivering nutrients to the baby too. So your body just went through something really huge with whatever type of birth you had, and it grew and birthed the whole entire human. And now it does need time to heal and recover and re-nourish itself, like I just said. And that can't really be rushed. So being patient, kind to your body in that time is really important. And that is where we see the most success and long-term kind of outcomes for the mom and the baby. And I think that we forget that postpartum recovery is also a lot more than what we see in the mirror. There's also pelvic floor, your core, your hormones, your energy levels, your mental health. All of those things are going through major shifts and changes too. So the focus can only be on getting your old body back. It should be on feeling strong and supported and healthy in this new phase of life as well.
And I think also with that, it's so interesting because when you interact with different patients, they talk about cultural practices, and there's so many cultures that celebrate new moms and really emphasize the rest that moms need post labor. So it's definitely something I wish we could move towards. But okay, Amanda, anything to add there?
Yeah, I hate the term bounce back. When people say to me that that's like a goal if they come in postpartum with their cute little baby, the first thing I think of is why. Like, why would you want to bounce back to who you were? You've just created this incredible being. You've just taken your existence to the next level, and your brain, your body, your physiology has all been reprogrammed to optimize your new role as a parent. So there are tons of brain changes that happen that make us more efficient, more sensitive to sound. It's incredible the things that our body has just gone through. And you'll never be who you were before you created this little human. And after meeting my daughter, I wouldn't want to bounce back. I'm just so grateful to my body for all it did to create, birth, feed, and continue to nurture her. So I think, as Dr. Sasha said, do what you need to do to nurture yourself, to get back into your exercise routines, to eat healthy, to be well, to be active, go on a stroller jog if you can with your little one. But I don't think you need to go back. Just keep moving forwards.
Since we started Advanced Women's Health, we got one consistent question. Will you treat my partner, my boyfriend, my husband, my friend? And we have always had about 20% of the advanced women's health population of patients being male. But we know that our lovely men want a home of their own. They want focused evidence, focused treatment, and they want an opportunity to engage with a practitioner that is just relatable. So we launched Advanced Men's Health last year, and it's been a growing project across our Ontario clinics. Men need specific types of support, specific types of coaching, but what we heard from patients all the time is when their partners were seeing someone else, they may have conflicting plans in the home. They may be in a situation where their partner's told to eat one dietary approach and they're told to eat something different, or their partner's like, this insulin thing sounds really cool. I want to understand, or I want to get the same gut treatment as you, but I don't know if that's indicated. So again, we have created an opportunity to have the same pillars, the same frameworks, the same understanding, and the same style of approach so that families can get well together. Because fundamentally, that is something that we know in the research, we know in practice is so effective, is when couples, when teams, when people work together and they hold each other accountable following a similar plan. So if you have a partner who is interested in care, you can reach out to the Advanced Men's Health team or see advancedmenshealth.ca for more information. Our team is consistently expanding. Right now, we are operating out of Ontario, but soon we will be in BC, and even sooner, I'm sure we'll be expanding to other provinces. If you want to get your man healthy, then we have options for you. Now back to the episode.
Okay, so we've busted a lot of myths today, but why don't we spend a little bit of time focusing on the bigger question? For people that come into our office, how are they to navigate the advice that they're receiving during pregnancy? So whether it's family who really come from a good place, or even friends from the internet, from strangers that feel entitled to their body and their choices, how would you, or what advice would you give to someone then to navigate that?
Yeah, good point. I would definitely say building a care team and having professionals and providers that you can trust to help you navigate through these confusing but exciting times is really key. And sometimes that's not the traditional care team that you might expect. Sometimes it's not your GP or your gynecologist. Oftentimes it is, and that's very helpful. But sometimes people can't get the resources that they need or the time that they need in those appointments. So sometimes it is other health professionals like naturopathic doctors, like physiotherapists, even massage therapists, perhaps, and other kind of avenues that you can go down to really build that care team that you can trust, and having someone that's well educated and evidence informed that can guide your mind and steer you with what's right and what's wrong and what information to trust and what maybe to question a little bit more is super important, because there's a lot of information out there and a lot of misinformation out there. So having an educated and supportive team to help you navigate through this time and also take the pressure off of yourself of are you doing everything right is super, super important.
Yeah, I will say working with a doula is super
Do it.
empowering, right? You've got that advocate on your side. We've got Dr. Sasha here, who's also got the training. A psychotherapist who's trained or at least informed in pregnancy can be really great. And one thing that I recommend is creating a birth plan. So some people are dead against this, and I'll explain why I do recommend it. The reason is in doing your research to create a birth plan, you will understand or at least have a little bit of insight or knowledge as to what possible birthing outcomes there are, delivery options, medications, no medications, positions, locations. You could deliver at home, at hospital, or at a birthing center if there's one local to you. There's so much about birthing that we can be kind of anxious or worried about during pregnancy because it's that fear of the unknown. Let's take away the fear of the unknown by educating and empowering yourself. And so that's why I say make a birth plan. Now, the baby will come out however the baby decides. You really have no say, unless it's a planned C-section ahead of time for whatever reason. So it's nice to be flexible and adaptable and open to different types of birth, of course, because the baby will come how it comes. But the action of researching to create that birth plan can be really empowering.
Okay, that's really helpful. And even what you both touched on can be overwhelming, right? Patients are often shuffled through their appointments. And so that already feels like there's a lot of time that's put into that. And then the reality is they find that, okay, if I go to someone else, maybe I'm going to get conflicting advice from different providers. That can also happen. That can be frustrating. But medical practice isn't monolithic. So yes, different providers can have different philosophies. We're trained in different eras or school of thought, and we work in different contexts, but it's nice to build your village, like they say, because this is such an important time of your life. And so whether that's your birth plan, like Amanda mentioned, or having different providers on your team, a birth doula, a naturopathic doctor, a pelvic floor physio, there's so many people out there that can support you. So Let's look at some final takeaways. If you had to summarize one thing that you want most listeners to hold on to from this conversation, because it was quite long, what would that be? Sasha, do you want to maybe start?
Sure. I think I would really want listeners to know that it is so normal to ask questions, to be Googling, even turning to social media and getting confused during pregnancy, because it is confusing out there. And even the medical doctors and professionals don't know everything or have everything right. And I think oftentimes the reason why we're Googling and trying to figure these things out is because we care. And it's because we want to do everything as efficiently and as good as we can to have a successful birth and a really healthy baby, of course. So I think the biggest thing I want people to take away out there is that there's no one right way for you to have your pregnancy, for you to have your birth, or for postpartum to look. Every experience is unique, and it's okay if it doesn't match what you saw online or even what you expected or even what your birth plan was. So give yourself some grace, trust your body, and remember that recovery afterwards is always a process, not something that needs to be rushed at all. Amanda, do you want to say your thoughts?
Yeah, I love that. I know. Trust your body is so important. So I think pregnancy is a great time to do some self-care. You're going to get to know yourself in a new way because your body is changing. Your hormones are changing. Your perception of the world is going to change. So take your self-care. Take this time to get to know yourself, to, if you have a partner, to spend some time with your partner and honor your relationship of 2 or 3 before you become 3 or 4 or more. And I think exercise should be a huge part of that self-care. As long as it's done in a safe and gradual way, take that time, work out, explore your body in its beautiful new state, and just cherish every moment because it goes by so fast.
Okay, for me, I would say the myths that we discussed today exist because they were spread through people who care about you, right? Your mother-in-law, your coworker, your friend, they are usually trying to help, but sometimes good intentions don't always come through. So information is your friend, and the more you actually understand what's happening in your body and what the evidence says, hopefully the little less anxious you will feel and the better decisions you'll make. And of course, if we didn't necessarily add this too, it's to see a pelvic floor physiotherapist, right? It'll be worth it. It's not something I find that, we can talk through it. And I know patients are oftentimes anxious about that if they haven't already done it prior to being pregnant. That one brings fear, but it's worth it.
Totally.
Honestly, I try to educate as much as possible during our sessions. I've always got my pelvis friend here to do some anatomy teaching, and I always welcome partners to come too, because 2 sets of ears are better than 1. And when we're preparing for birth, we do partner sessions, so pain relieving partner positions, teach your partner how to do perineal massage. So book in with a pelvic floor physio. If you're in the area, come see me or book virtually or go see someone local that's trained in pelvic health. And I think it'll be really empowering and help you feel a little bit more confident as you approach delivery as well.
Yeah. Actually, I have a question for you, Amanda. When would you suggest, when along pregnancy journey, would you suggest someone to come see you first?
I'm so glad you asked. That's a good question. So no sooner than 12 weeks. We want that first kind of trimester to settle first. And so usually I don't see people until 14, 16, or even 18 weeks. And that's when we start to see those body changes. And then we can start to look at the biomechanics of movement, the posture, the different sensations that start to happen around that time. And then we'll continue to follow you throughout the rest of pregnancy up until 38 weeks. We'll be doing our perineal massage and getting you ready to prep for delivery.
Cool. And probably even do some postpartum stuff too, I'm sure. So
Absolutely. So yeah, waiting that 6-week period until you follow up with either your OB or your midwife, and then coming back in to check internally. But if it's not anything internal, you're welcome to come as soon as you're ready. We don't need to wait 6 weeks.
Awesome.
One that I'll ask, I wonder if people are as curious. I know you mentioned in person or virtual. How does care differ? Does it differ?
Yeah, it's a good question. So there's always that nice kind of biofeedback piece that you can get with in person if we're able to do some hands-on work. But I do a lot of verbal cues. I'm very descriptive on my virtual visits. So I try to give people a lot of different cues so that they can experience their bodies in a very specific way. So the education piece stays the same. It's just if you need that tactile cueing, that hands-on facilitation, like if you need to be touched on your shoulder to feel where your shoulder is, then we'll work through as much as we can do virtually, or I'll kind of coach you to do that yourself. But if you're able to come in person, I'm always happy to do some.
Amazing. Okay. That is, I'm sure, helpful for any listeners who maybe don't have a provider close to them locally. That option still exists. Okay. Well, I want to thank you all for joining us. For those of you listening, thank you to Dr. Sasha and Amanda for hopping on with me to talk through everything fertility myths and pregnancy myths. If something in today's episode resonated, if you know someone who's pregnant, trying to conceive, or you're even supporting someone who is, share this episode with them. Until next time, take care of yourselves, and remember, you know your body better than anyone else does.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.